This is the El Paso County Public Health Board of Health meeting for April 28th. And I know we are live streaming this. It'll be on a couple of different sites, the Board of Health site and the Facebook page here pretty quick. Uh-oh. All right. And so I think we should start with a board member roll call to see who's online. So Commissioner Bremer, are you here? Give us a thumbs up or a howdy. Commissioner Bremer? Not yet. Okay. Commissioner Longinos Gonzalez.
Howdy.
Hey, sir. Good morning. Welcome. How about Council Member Yolanda Avila?
Here.
Thank you. Council Member Sam Geek.
I'm here.
Morning. Kari Kilroy.
I'm here.
Doris Mino, Dr. Vu, and Fire Chief at Colas. We've got that, and myself. So we certainly have a quorum this morning. All righty. Our first action item is the approval of the agenda, which everyone should have in front of them. Any questions or I'll
Those are the IT guys.
the IT guys. Can we ask IT guys to maybe mute themselves or go in and go? Okay. IT guys. Hello. Woo-hoo.
Are they in the next room or where are they?
I'm trying to mute them. It'll just be.
Okay, you should be good, Dr. Turvis.
We're good now? Okay. Let's proceed with the first action item, which is approval of agenda. And any comments, or can we go ahead and I'll entertain a motion to approve?
Yolanda, move to approve.
Okay, and a second. We have one here in the room. All in favor?
Aye.
Okay. Well, big deal this morning. We get to introduce a couple of new board members, and I'm excited that they're here with us, and I think that there's a lot to be gained from their participation and membership. So let me go ahead and start with I've asked the two new board members to maybe give a brief introduction themselves, and we can welcome them. But let's start with Fire Chief Ted Colas. Can I still call you Chief? Is that okay? As an honorific?
I'll take this off just to respond.
Okay.
But I am the former Fire Chief of Colorado Springs and been in the community a long time. Been involved with pre-hospital medicine for my entire career. That was 36 years in the Colorado Springs Fire Department, and just find it a real honor to be able to be part of this board and to be able to participate in my community and helping to keep my community safe. It's an honor, and I look forward to being an active contributor to the Board of Health.
Thank you. Thank you, Chief. Dr. Vu.
Yes.
And welcome. And likewise, we're really glad that you're here and participating with us. Can you tell us a little bit about yourself and also perhaps about some recent developments?
Yes, sir. I'm a practicing internist here in Colorado Springs. My wife and I moved here in 2004 when we started our practice. My wife is a practicing pediatrician here in town. We started our practice here in 2004. I'm also very honored and privileged to join the El Paso County Board of Health. I want to make a difference. I want to make a difference in the health of our community. The mission of our practice is, and the mission for my wife and I is to provide a high level of care to all people, all patients from all walks of life. So our practice recently purchased the old AMC Theater on South Academy and Fountain in the 80916 area code. We are very excited about that. We will convert that theater into a multi-specialty medical clinic with a heavy emphasis on primary care for adults and children with integrated behavioral health. We hope to start a COVID vaccine pod at that location early May. I know that demand is decreasing somewhat, so the capacity of that location will depend on the demand. I'm very much honored and privileged to be part of the Board of Health. I am aligned with the mission of the Board of Health, and the mission is to promote and protect public health and environmental quality in the community through people, prevention, and partnerships, subject to availability of funding, and to work toward providing the 10 essential services as outlined by the National Association of Local Boards of Health. I am committed to participate and provide informed input to the board. I am committed to be a team player as a board member. I am committed to follow the leads of leaders on this board. And thank you for coming me. Thank you.
Well, thank you very much. Just a quick comment on my part, a great alignment between public health and clinical medicine, especially primary care and behavioral health that you've mentioned. So I thank you a lot for that. Fire Chief, you know I have a special place in my heart for the alignment between public health and public safety. So really welcome your participation and thanks again. Welcome aboard.
You're welcome.
Okay, well, good. I have a little bit of a comment here about the NALBO, and several of us here in the room participated in a NALBO conference a little over a year. It seems like longer. It's been a full year, more than. And NALBO, the National Association of Local Boards of Health, provides a really valuable nationwide service to boards of health and establishes what I think is a standard, sort of like a good housekeeping seal of approval, and that we can align ourselves with guidance from NALBO. And in your Board of Health member packets this month, we have something that I referred to last month about the governance functions of local Board of Health. Now, they're not exactly proscriptive. They are guidance recommendations, and there's a checklist in there too. And I think at some point, not today, we'll see how we're doing. But I would encourage all the board members to go ahead and go through that checklist, and even if you know, Director Whelan and I have talked about some of those already, and we have already talked about where some of the boundary lines are. For instance, I don't think the Board of Health necessarily is deeply involved in internal to the Public Health Department policy decisions, but external, that is within our bailiwick, and a number of other things in there. So I won't belabor. I would ask you to review the 6 governance functions of policy development, resource stewardship, legal authority, partner engagement, continuous improvement, that's always a good one, and oversight. Those are within our wheelhouse, as they say, and so we'll get to talk about those again. Let me be quiet here for a minute and hear from other board members. Other Board of Health member comments, please.
I would just like to thank the staff of the health department and the leadership for all the work and the partnerships that they've made. I mean, it's made a huge difference in what our community was able to accomplish so far and will continue to accomplish, not only with COVID, but I think it's a good precedent for other future endeavors. And I thank you very much and really applaud you for all that you've done. Thank you.
Other Board of Health member comments?
As Commissioner Gonzalez, I just want to welcome the two newest members, and again, I want to thank Public Health also for all the great work and all the health professionals that have gotten us to this point after a year. It's just been so very difficult, but the work, endless work, being done is what's helping keep our community safe. Thank you.
Thank you, Commissioner. Let's see, we have a hand up out there. Who is that?
Bremer.
Is that?
Commissioner Bremer.
Oh, welcome. Hey, Kimmy.
Hi. Also, wanted to welcome our two new members. You both will make really excellent and well-rounded additions to the team. And I look forward to some great discussions with you on this board. I also, once again, just wanted to say thank you. Thank you to all of the staff who have, as Commissioner Gonzalez said, gotten us to this point. And I realize that you've had to kind of constantly balance a duty and a drive and a career of enforcing regulations for the purpose of greater public health. You've had to balance that all along with a lot of input that wasn't always receptive to that. And so I just wanted to thank you for the professionalism with Board of Health, our Board of Health members and our Department of Public Health staff have handled that just with grace, with an incredible work ethic. And we're not quite done yet. There's still work to be done, but I am just so impressed and so proud of every single one of our Department of Health employees. And Susan, under your excellent leadership, and Dr. Johnson, and so many others that have just kept the wheels on the bus in the last year. It's very impressive, and I'm so very proud of you.
Thank you, Commissioner Bremer. I think Councilmember Sam Geek has his hand up. Please, Sam.
Yes, I'd like to welcome the two new members, and Ted and I go back quite a ways. I was on the fire department a long time ago with Ted, and I really am looking forward to working with him again and Dr. Wu, and I want to thank the staff and how well they've handled everything. Fountain is just excited as we can be about how everything has worked out with this South complex, and if there's anything I can do, let me know, and I really appreciate everybody's work. Thank you.
Thanks, Sam. Other Board of Health member comments? Any other hands out there? Well, just to complete the circle, again, welcome. And looking back, I mean, a year ago, we had so many unknowns that we were going to deal with. But I think that we as a community, and we especially as a Board of Health, can be both humbled and grateful to the public health leadership. Thank you so much, Susan, to you and your staff for leading us through this past year. I like what Commissioner Bremer said, keeping the wheels on the bus, and bringing us here now to where we have vaccinated a large percentage of our community. We can see the goal of herd immunity in view. The restrictions are coming off, businesses are opening up, and definitely save some lives. And thank you very much for that. Okay, well, let's see. The next action item is approval of the minutes. You have that as part of your packet. I'd entertain a motion in a second, please.
So moved.
Second.
All in favor?
Hi.
Right. Okay. Nikki Simmons, here to make numbers fun. Welcome. Good morning.
Good morning, Board of Health members. Nikki Simmons, County Controller. Just have a quick summary this morning for you for the March 2021 health financials. So as you can see, we are trending a little closer to our budget in the revenue lines. A primary portion of that is that the state did issue the PO and contract for them to pay us for the license fees that we waived under the state bill for restaurant licenses to free up that money for the restaurants. So that has happened. So we've been paid almost in full for our normal amount of restaurant licenses. Other than that, everything besides some of the program-specific grants have been coming in very close to budget. Those program-specific grants are things where we have continued to rededicate resources towards COVID response. But we have the funding for the COVID response in another area. So really no concerns on your revenue side at all. The expenditure side, we still do have some underspending compared to some of the money that we appropriated into 2021. But some of that is staffing. Obviously, it's hard to find at this time. So at this point, we have a positive net impact to budget and have not spent into any reserves. So the other part of that, I just wanted to give a heads up or a briefing on. We have significant other grants coming in. We've briefed the board in the past months, but we do have some epidemiology and laboratory capacity grants of just about $1 million in addition to previously estimated amounts. We also have $1.7 million for vaccination funding. So I just wanted to assure the Board of Health that the things that we are doing to respond to COVID-19, we have the funding for. In addition to that, El Paso County is going to be receiving money through the American Rescue Plan Act and is committed to allocating money to public health in case there's needed money that's not covered by one of the other grants that's flowing down through the federal government. So other than that, that's all I have. I'd be happy to entertain any questions from Board of Health members.
Thank you, Nikki. Any questions for Finance, Nikki Simmons? We do have an action item here, which is the resolution to recognize revenue and appropriate expenditures in the amount of $2,669,759 for COVID-19 number 2 and number 3 immunization funding as contracted with the Colorado Department of Public Health and Environment. So I'll go ahead and read that resolution into the record quickly. Let me take this off. Whereas this project aims for local public health agencies to plan and provide direct services for the COVID-19 vaccine. Local public health agencies will promote and provide COVID-19 immunization services throughout the state according to established best practices and standards and in alignment with the state of Colorado off-site vaccination clinic operational playbook. And whereas the goal of this funding is to reduce vaccine preventable diseases in Colorado by increasing or maintaining immunization coverage. And whereas the objective for this funding is that the El Paso County Public Health Department shall implement evidence-based strategies to provide COVID-19 immunizations in their jurisdiction. And whereas expected results of this funding is that the COVID-19 vaccines are promoted, offered, and administered through the El Paso County Public Health Department. And whereas funding for immunization COVID-19 number 2 in the amount of $977,974 will be effective 1 November 2020 and extended until June 30th, 2022. And funding for immunization COVID-19 number 3 in the amount of $1,691,785 will be effective March 24, 2021 to June 30th, 2024. And now, therefore, let it be resolved that the El Paso County Board of Health does hereby recognize revenue and appropriate expenditures in the amount of total $2,669,759 to the El Paso County Department of Public Health. It's further detailed and done this 28th day of April 21 at Colorado Springs. So discussion, questions?
So I can just talk to that real quick. That is very simple. It's the 1 million and the 1.7 million that I mentioned earlier that's covering
Right.
a lot of the expenditures that we are seeing right now. And it's money that's flowing through the Colorado Department of Public Health and Environment, but it stems from federal funds.
Those are
So
federal
these can be
funds,
monitored with federal. We have the controls and procedures in place to ensure that we're monitoring those federal funds correctly and in compliance with all the requirements.
Thank you. Yes,
I have
Doris.
a question on the fourth whereas, where it says will be, should that be was effective November 1st, 2020, or should that have been November 1st, 2021? I'm just curious.
Well,
The language.
I think they said will be, because once you accept it, then the effective date would go back.
Okay.
That makes
Thank you.
sense.
Okay.
Okay. Other Board of Health member questions, comments? If not, I'll entertain a vote in a second.
I'll move to
Okay,
accept the resolution as drafted.
okay. Second,
Second.
all in favor to approve?
Aye.
Aye. Okay. Good enough. Thanks, Nikki.
Thank you. Thank
Appreciate
you.
it. All right, moving along rapidly under new business, we have a resolution to set a public hearing date for amendments to on-site wastewater treatment systems regulations. And we have Kat McGarvey and Mary Ritchie, our new lawyer. Welcome.
Good morning.
Who's speaking first?
I'll go ahead and speak first. I'm Mary Ritchie. I am Assistant County Attorney. I'm
Hi,
a
Mary.
newly appointed legal advisor to the board. And since we have some new members on this amendment to our regulations, we just wanted to go through quickly the process. So obviously, we're here to talk about holding a public meeting regarding a pre-construction review, which is a new process, and Kat will talk about that. The proposed date for the meeting is May 26th. According to Colorado statutes, the board has the duty to develop and adopt detailed rules for the on-site wastewater treatment systems, and those are septic systems for those of you that aren't familiar with the term. Let's see. Next. Before there's any amendment to the rules, the local board does have to hold a public hearing on the proposed amendments and give notice. Next slide. Any person may propose regulations. Here we have staff, Kat McGarvey. She's the manager of the water program quality manager. And if the legal advisor, that's me, determines it is within the board's authority to adopt, I draft the resolution, and I have determined it is, and it contains the necessary requirements. And these are our administrative procedures, the El Paso County administrative procedures at Chapter 2. Next slide. And so what you're here to do is to adopt, modify, or reject the resolution at your sole discretion. We're considering it the first available hearing. And if ordered, they will give notice. The secretary of the board will give notice according to the rules. And the notice will advise that a complete copy of the proposed regulation will be available for public inspection and copying at the public health offices. That's at Garden of the Gods, and may also be made available on the internet. Next slide. And just so you know, according to code, after the public hearing before final adoption, the board may make changes or revisions, and no further public hearing is required. And we do coordinate with CVPHE to make sure that they approve of the changes as well. And the amendments that we are proposing have been run past them already. So, and we have made changes accordingly, and that's what you'll hear about today from Kat. So I could turn it over to her.
Thank you.
Oh, and may I say one more thing?
Yeah.
Please take a roll call vote on this one. Thank you.
Okay, good enough. Thank you. Appreciate it. Kat, you're up.
Good morning. Thank you, Mary. And like Mary said, for those of you who are new to the board or have not met me yet, I am the Water Quality Program Manager and have been in the role for about a year, a little over a year now, I guess. During the pandemic and everything that we've experienced over the last year, on-site wastewater treatment systems was one of the things that never really stopped. So just a brief overview and background. We do speak in terms of on-site wastewater treatment systems because we are moving from a disposal mentality to a treatment mentality. So our goal with these regulations is really to ensure that we are adequately treating this water and this effluent prior to it re-entering our groundwater systems and moving down the line. So about a month and a half ago, our permit turnaround times are pretty lengthy because there is some soil review that has to happen and multiple steps in that process. So our typical new construction permits take about 2 to 4 weeks to review and approve. We do have to coordinate with an outside agency, develop services through regional building for outside approvals of their site plan and overall layout of their construction as well. In El Paso County, over the course of the last year, our new construction has significantly increased. Routinely, El Paso County is one of the counties in the state of Colorado that historically issues, we're either the top 1 or 2 counties every year for issuing permits. And that's new construction, repair permits, minor repair, any type of permit to do work on an on-site system. So we issue about an average of 600 permits per year. And it's only going to increase with the new construction and several new developments that are being approved throughout the county, specifically out east, a couple of 100+ home developments that are going in out there right now as we speak. So the impact is a lot of times the general contractors are the ones who are submitting septic applications or on-site system applications, and that tends to be at the back end of their process. So according to our current regulations and the state regulations, the building department cannot issue a building permit to a facility or a building that does not or is not currently being serviced by a central sewage disposal system or a wastewater treatment work system. Meaning that if this new structure is not connected to anything currently, which it wouldn't be as a new structure, they cannot issue a building permit without physically having an on-site wastewater treatment permit issued for that property. So we are seeing an increase in new home demands, which is also putting a strain on our engineering section. And El Paso County does require to stamp all soils reports. So many of our engineers right now are 2 to 4 weeks themselves out from soils analysis. So there's many things with this increased demand that are impacting and delaying potential issuance of new permits. So based on some feedback we're getting to the commissioners from the Home Builders Association and general community members, with the delays that they're experiencing, we are trying to increase our customer service and find a way to work with the industry to ensure or expedite the issuance of a building permit for them. Typically, they need the building permit to get started. The home building process takes a lot longer than installing an on-site system. So we're working to try and educate those general contractors, but that is a really long process to do to help get them to a point where they can submit those applications sooner. So trying to come up with another idea that we can expedite this process, and working with regional building and Roger Lovell and Craig Dossie and our director, Susan Whelan, to try and find how we can better assist the industry. Next slide. So what we have decided, excuse me, is something along the lines of a pre-construction review. And it's going to have to be issued in a permit, and that was part of the feedback that we got from CDPHE because regional building cannot issue the building permit without having a permit in hand for the on-site system. So what this would do is essentially when that application for new construction is turned in, we would then look at it to make sure that we would be able to issue a full construction permit on that site, but there would be no limits to what could be done, meaning, the site's going to allow for installation of an on-site system. There's not going to be any potential impacts that would allow us or cause us to deny the building of an on-site system on that lot. we don't typically have many lots here in El Paso County where that would be a concern. We do have to get pretty creative sometimes, but that is on existing lots most of the time. Anymore with land use code, the new developments that are going in, they do have to have a minimum of 2.5 acre lots when they do have an on-site wastewater treatment system. So most of the lots are adequately sized to support that. So that's not going to be a big or a significant concern most of the time. However, we will likely have to look for limiting layers and soil type. El Paso County has a vast variation of soil types throughout the county, and many of them have high rock content soils, which does limit treatment capacity. So what we're going to do is we're going to have to look through that soils report to make sure there's nothing that would preclude or that the system they're proposing is adequate for that site, as a brief overview prior to issuing what we will likely term either a pre-construction permit or a conditional permit, as we work to move forward in the next 30 days to refine that for the state. We did go through some partner review and engagement. Like I mentioned earlier, we have had multiple discussions with Matt Mattson, the permit supervisor at RBD, and Roger Lovell, the regional building official, in addition to Craig Dossie and his team on the county side, trying to figure out how we can work through this process and get a better or have an option for the community to get a building permit a little bit quicker. And I just have a quote on there from Roger that he sent in the course of our conversations. You know, this is a great example of working to help the community. And then throughout the course of just general conversations I have with GCs during the day, and just, in indicating that we're working on this process because they are pretty frustrated with turnaround times. But they're not thrilled with a fee, but because it is an extra service and an extra step that's going to take us some time, we will have to assess a fee for that. But they would be supportive of that service and really enjoy and would like to have that available to them so that they can get their building permits a little quicker. Next slide. So for this is just kind of where those regulation changes are going to occur and into the regulation itself. So we are going to add a definition. A lot of this will probably need to be amended as I work with Mary based on the state's comments, but we will get that amended and put in there. We'll put a definition for pre-construction review in there or the permit and put some parameters around that as to what we will be reviewing. And then in the applicability section as well, so that we have the ability to issue this permit. The other thing that comes with this, like I said, is a fee. With the changes from the state and the slightly more in-depth review this will cost, I'm going to work with Mary to determine if that $50 is adequate, or we may need to go look at a higher cost for that with the additional review that would be necessary. And it is my knowledge, my understanding, my interpretation based on conversations with Mary that our statutes for on-site wastewater treatment system permits do allow us to recover the full cost of both indirect and direct services related to on-site wastewater. Right now, that cost would be about 52% recovery for the service. But as I said, that could change in the next couple of days as Mary and I work through the changes from the state. Next slide. The pre-construction review process is really designed to help the community and find a way to partner with the community and build those partnerships and increase our ability to help them get building permits a little bit quicker. So that part, we've engaged community, we've engaged our partners. So I think we have a really good starting block there, and we'll move forward with the changes from the state. Additional items that we are looking at putting into our regulations is an operation and maintenance permit. And this is where we really start to focus on the treatment of effluent versus the disposal of effluent in the groundwater system. Our current regulations in section 8.14 require us in the county to have an operation and maintenance program and an oversight of systems that are utilizing higher level treatment, which in our regulations is defined as pressure distribution or an in-tank, usually a nitrogen reduction system or some sort of oxygen introduction into the tank to help treat that effluent prior to it entering our groundwater. And the reason that this becomes important is we in El Paso County can allow reductions in system sizing and setbacks to vertical separation distances to things like our groundwater table, to help some of these systems go in a more user-friendly, lot-friendly style. And in order for us to do that, we have to have a maintenance program to ensure that those systems remain functioning as they were designed. And right now, we are working on developing this program. It hasn't been developed in the past. It's usually fallen off the table as one of those by the wayside. However, the state has informed me that they are moving towards auditing counties who have requirements or reduced system sizing ability, to audit the counties to make sure that they are meeting that operation and maintenance section. So this is a really important section as well. Operation and maintenance it has to be conducted by a certified operation and maintenance inspector, and it does require homeowners to maintain a contract with them. Typically, those contracts are right now, based on what I'm hearing, anywhere from about $400 to $800 for a 2-year contract right now. It's based on system sizing, based on system type, and the amount of intricacies within that system. This section also requires these systems to have an annual inspection to make sure that they are functioning as they are designed, and that is continued operation. Next slide. So currently in El Paso County, we have 270 pressure distribution systems that have gone in after that July 7th, 2018 date where this would be effective for those systems. But we have many more pressure distribution systems beyond that as well. In-tank treatment, we have about 28 of those currently in the county. And we have 4 certified O&M specialists right now. And what that means is that they have taken the National Association of Wastewater Technicians operation and maintenance course, both the 1 and the 2. The 1 uses really our basic overview of systems, and then 2 really gets into the nuts and bolts of how we work through operation. What we're looking at is through operation of many other counties and trying to align with similar counties, systems that are installed meeting that criteria for the required operation and maintenance. Upon final approval of system installation, as well as on their construction permit, applicants are notified. So we do put on the construction permit that system would fall under the guidance of operation and maintenance requirements. And then we also send a letter that notifies the applicant, and we do send it to the physical property address so that we are getting multiple avenues and making sure that they are notified of these requirements. Upon submission of the operation and maintenance contract, what our proposal is to issue an operation and maintenance permit. Through industry engagement, we determined that a period of 2 years is a good time frame, that they would be issuing maintenance contracts for 2 years. And a lot of that aligns with the not courses are valid and you're certified for 2 years. So that'll help keep us on track with making sure everybody stays certified and that everything is lining up time-wise. Next slide. So through industry engagement or stakeholder process, we have that group of 4 operation and maintenance specialists right now who are helping to develop this program and build this program. We're creating standardization throughout the inspectors, which means we're having El Paso County has built inspection forms for them to use, and we will require all inspectors of this program to utilize those forms. We'll develop a guidance document for filling those out so that everybody has clear expectations for that as well. They wanted to make sure that we were, for consistency's sake and for our community members' knowledge, to make sure that we were aligning those maintenance contracts with permit issuance and making sure that everybody had some sort of a consistent process. And that's where they landed on that 2-year period. Next slide. So this slide just shows an overview of similar counties that are currently involved in this or have programs up and running right now that sort of align or we work closely with in that area. So they all issue a permit. They all issue some sort of permit for these. Typically, they're called an operating permit or a higher level treatment permit. A lot of them, the permits, they are coinciding with the length of the maintenance contract. Currently, only one county charges a fee for these. There is going to be an extended amount of work involved in this on our end. So as we go through our fee analysis currently, we will likely add, look at maybe potentially having a renewal fee for these and the homeowners as well. They do all require submission of maintenance contracts, and only a couple of them require a actual inspection to be submitted to them. Many of them are just going based off the maintenance contract in the understanding that that person is actually providing what needs to be done for that system. However, the regulations do state that inspections are required, so El Paso County will require those to be submitted. Next slide. And so in summary, this is just our, oh, I have the wrong title up there. I apologize. This is the operation and maintenance information and where that's going to go into the regulations. The state only had minimal feedback as far as just changing the definition to say system sizing reductions as well, so that it's encompassed in there also. But otherwise, the state did not have significant changes or feedback on this section as well. The fee, as I said, the first permit would be issued as just a function of having a construction permit that requires this. And then we could potentially consider a fee for renewal moving forward, but more to come on that. That is all I have. If you have questions, I'm happy to entertain any.
Thank you, Kat. I believe we will. Mary, I'm glad you're here. Before I make any comments, let's go out to the other Board of Health members. Any questions or comments? You should have in your packet the on-site wastewater treatment systems regulations and the proposed changes in red. And thank you, Kat, for highlighting those to us. So Board of Member comments or questions, please. For either Kat or Mary.
Kat, I have a question for you. So the purpose of this is really to expedite construction, is that correct?
For the pre-construction reviews, yes. Finding a way to work with that community to help them get that building permit quicker so that they're not delayed in building those structures.
And so on page 10 of the materials that we received under the definition of pre-construction review, it says allowing an applicant to obtain a building permit prior to issuance of the OWTS permit. So the building can go ahead and get started without the OWTS permit. Is that correct?
So that's one of the things that the state kicks back to us. We will have to revamp that slightly, and what we issue to them as a pre-construction acknowledgement will have to be called a permit. So they will technically have an OWTS conditional permit, which will notify them that the risk is on the applicant should something significant change in their design review. We don't see that a ton, so I'm not overly concerned about it, but we will change it to being a permit to accommodate the state's feedback. So they will technically have a conditional permit prior to getting their building permit.
Okay, thank you for clarifying that, because I felt like that with looking at page 16 of the materials that we received, it seemed to be in conflict.
Yes, and we will rectify that before we get to a final version.
Thank you.
Absolutely.
Other Board of Health member comments or questions?
I've got a question
yes,
for Kat. Kat, you mentioned that right now there is a lengthy delay in getting these permits issued. What is the average time that customers have to wait?
So I actually ran data for the first quarter of this year, and right now we are issuing all of our permits are being turned around. 82% of our permits are being turned around in under 21 days. 52% of those are actually being turned around in under 14 days. So many of the ones that are extended beyond 21 days are due to engineering error or kicking back for design requirements that were not met or regulatory or within regulatory compliance. However, right now we're getting about 82% of those out within a 3-week period.
Okay, and how does that compare with other counties?
That is about, it is typically in line with a lot of other counties. And El Paso County actually does a reduced version of what many other counties our size do. So a lot of other counties actually go out and physically do a soils analysis or require soils pits to be left open where we don't. And they have some other steps in that process. So we're right in line with most other counties from what I'm hearing. There's no significant difference that I can detect in there.
Okay, and then the changes that you're proposing, they would have a significant difference on that, on these numbers?
So, yeah, we could issue a conditional permit for, we could review an application and issue a conditional permit in 1 to 4 days versus 10, 14 to 21 days for a full permit.
Thank you.
Absolutely.
Other Board of Health members, please. Okie dokie. Well, thanks, Kat. You're obviously very knowledgeable and quite professional in your presentation of this. And I know that today all we're voting on is approval for a date to for public comment and review. I would say that one of the very best things that we do as health department, and particularly in the environmental health area, is coordinate and collaborate with local businesses, industry, other government. It is that coordination and collaboration which I think has particularly made our body art and the restaurant inspection function successful and obviously collaborative. I would hope that this program and these new proposals would further that, and that the changes that you are proposing would make it easier and perhaps not less expensive, but less complex and more available and acceptable to industry as well. Susan, you had a comment?
Yeah, I'd like to provide some additional context, just broader, and I think for our new board members, in given this past year.
Mm-hmm.
So on average, health departments that are serving population sizes of 500,000 to almost 1,999,999 population have on average 256 full-time employees. At a steady state, our agency has 158 FTE. And we know that there has been dramatic growth within El Paso County, the city of Fountain, and we were able to purchase a building last year to expand some of our services. And I would just emphasize that we need to make continued progress on that. We received additional funding through the county commissioners to hire an additional 10 FTEs starting in 2019, and it's part of a 5-year funding roadmap where we go back and we seek additional funding for critical needs. And what our critical needs are, it's staffing. And the reason why I bring that up is because I think it's really important related to all of public health statutory requirements and our mission, given the staff that we have, what we're able to do. And with that additional funding to hire the 10 FTEs, that got us to 158 steady state. Of those 10 FTEs, we hired 2 additional environmental health specialists. As we know that we issue one of the top numbers of OWTS permits other than any other county, as well as restaurants, and we are expanding. And so we are making some changes over there, not only to continually work with the business community and get the feedback, and we've met with the regional builder development. It's all geared towards streamlining the process and serving our community and fulfilling our mission of, as you heard Kat say, in this instance, it's protecting groundwater. So I did want to say that in the COVID crisis response, our environmental health specialists have taken on duties that they have not before, that we have had no regulatory oversight. And so Kat has played a lead role, and some of her staff, while keeping up the OWTS permits and inspections, that we've had over 10,000 calls for technical assistance on gyms, athletic places, dance studios, massage places. It's, everything outside of our regulatory responsibilities. When the public health orders came through, and there were probably over 100 that were that came through, we had the responsibility to translate what those public health orders meant and what are those impacts to businesses. And our environmental health folks are the ones that worked with cross sectors and various different businesses to implement the public health orders, and also with our county attorneys. And I bring that forth because I think context is really important. This past year, we are committed to working with the business community and industry. I also want to just acknowledge the different responsibilities and pressures that we've been trying to balance throughout this pandemic, and they've been doing a phenomenal job. And I've gotten some good feedback and positive comments from general contractors, and they will be part of this process as we have public hearings. A lot of times what happens, and you heard Kat say that they meet with industry stakeholders and collaborate, and then they will come to the next Board of Health meeting and they will talk on behalf of the industry, because I do think that that's important, that public health does not make decisions in a vacuum or make regulatory changes without any feedback, and especially those that are going to impact.
Thank you, Susan. Thanks for providing that context. And it sounds like several things. One is that our public health staff in general has been pulled away from their typical jobs to respond to COVID. So maybe we're getting back more toward normal. And it sounds like that the process is working because there's going to be considerable opportunity for industry comment and review before this becomes a regulation. I saw a hand up. I think Councilmember Avila, please.
Thank you, Dr. Turbish. Thanks for that context, Susan. I really appreciate it. How many staff members should we have, or full-time employees should we have? Did you say 200 and what?
256. So this is according to the National Association of City and County Health Officials. They do surveys of all of the public health agencies around the nation. And for a population serving 500,000 to 900 and, almost a million, one less than a million, they have on average 256 full-time employees.
Okay,
and in a steady state, we have 158 full-time employees, and we, as you know, we're the first accredited health department in 2003. We were the first re-accredited health department. We received that in 2020. So we are a high-level performing agency, but I wanted to provide that context because I think that that's important with dramatic growth in building and population.
It absolutely is. And what I was thinking is that throughout the whole entire nation, we have seen with this COVID crisis and pandemic that public health has been underfunded, and across the nation. And then when we come here to El Paso County to see that we have almost 100, we're lacking about 100 full-time employees, we really have to come up to snuff on that. But that was pretty striking, and all the responsibilities that now the public health has, you and your staff. So it's overwhelming, actually. But I want to ask too about the wastewater. As this doesn't include Colorado Springs area, right? Because CSU works with all of that since we are in charge of water and wastewater. Can you speak to that?
Yeah, absolutely. There are actually still some pockets within limits that are on wastewater, on-site wastewater treatment systems. So for instance, off of Austin Bluffs and Barnes, Park Vista is what I think it's called back over in there. There's still some homes back there that are on-site. I think that pocket is still annexed county and not city, which is why they can still do that. There's also some back behind the Broadmoor that are on-site wastewater treatment systems as well. And then just north of Woodman Road, there's a pocket back there that still has on-site wastewater treatment systems. So there are still some within the city limits that have the on-site as well.
Okay, so most of the new construction though, because I think Cimarron Hills and that's, you know, that's not incorporated in the city, but would you say that most of all the construction that's happening is out and around the city in El Paso County?
A lot of what we're seeing right now is out in that Peyton Falcon area, off of Judge Orr and out east that way. Calhan, Yoder, down in those parts, we're getting a lot of construction, and Monument as well is a lot of.
I just really appreciate the tremendous work you're all doing.
Absolutely. Yes, go ahead.
Yolanda, could I just address one of the things that you mentioned? You know, we know that to get our number of employees up, it takes funding. Is that something that maybe that you could champion for us at the city level to maybe get some city money into there are many communities around the nation that receive funding from cities as well as the county, and that would be a source of funding. I'm just trying to think a little further out. I think that would be important. I mean, because I know that, you know, we have a development person on staff. I think it's part-time. And yes, we can get grants, but we need insured funding from year to year for some of these positions. And so that if grant funding isn't there, they don't just go away. We've discussed, you know, the short-staffed health department that we have since I've been on the Board of Health for years. And I just think we need to maybe start looking at some other, maybe as a Board of Health, looking at some other funding streams to bring us up so we can bring our staff levels up.
I would look into this, and just, it's like we need to look at a lot of the things that we're doing regionally. You know, we're looking at the whole county, but looking at different regions, government and agencies to see how we can work together to beef this up, because it's public health is just critical. So, and we see that with the pandemic, and I don't know that anybody has realized that the extent other than people really working closely with public health. So yeah, I'll do what I can, and maybe we can form some kind of task force or something like that.
Thank you.
Dr. Turbush?
Yes.
One more comment. Just for everybody's general knowledge, when on the fire department side within the city, when we work with construction services and we're issuing permits and that sort of thing, when we work with the industry, I think what Kat said is absolutely true. The industry typically doesn't show resistance to increased fees if those fees result in better customer service. They're willing to pay for the service if we can guarantee the service. So I don't think the fee increase is going to be necessarily any kind of a stumbling block. The industry will probably embrace that.
Good point. All righty. Our job today as Board of Health is actually pretty straightforward, which is that we're going to read the resolution and vote on this public hearing. And at that point, we will have additional input from industry and business groups. And it sounds like that's the process that's typical and approved. And we want to do it just that way. So any other comments or questions from Board of Health members before we read the resolution into the record? Hearing none, I'll go ahead and read this. Resolution to set public hearing date for amendments to on-site wastewater treatment systems regulations. Whereas pursuant to Section 251506 Colorado Revised Statutes, the El Paso County Board of Health has the power and duty to initiate and carry out health programs consistent with state law that are necessary or desirable to protect public health and the environment. And whereas pursuant to Section 251508, the Board of Health has the power and duty to adopt rules not inconsistent with the public health laws of this state. And whereas pursuant to the same section, the Board of Health has the power and duty to provide environmental health services and to adopt fees to offset the cost of environmental health services and other public health fees in El Paso County to carry out its powers and duties. And whereas upon review of the current El Paso County Board of Health Chapter 8 on-site wastewater treatment system regulations and associated fees in Chapter 3 fee schedule and civil penalties, it has been determined that a need to amend said OWTS regulations exists. And whereas the Board of Health has determined that it is appropriate to conduct a public hearing to consider adoption of the proposed amendments to the OWTS regulations as it deems appropriate. Now, therefore, be it resolved that the El Paso County Board of Health shall conduct a public hearing at its regularly scheduled meeting on Wednesday, May 26, 2021, commencing at 8:30 at the El Paso County Citizen Services Center, 1675 West Garden of the Gods Road, Suite 1044, Colorado Springs, Colorado, to consider the amendments to Chapter 8 OWTS regulations and associated fees in Chapter 3 fee schedule and civil penalties attached hereto as Exhibit A. Be it further resolved that El Paso County Public Health is hereby directed to advertise said public hearing as required by law. Moved, seconded, and adopted. So, any other comments or questions before?
Roll call.
Yeah, roll call on this one. Good. Okay, I'm going to go around the room. Commissioner Bremer, and we need a yay or a nay, please.
If I can find the mute button, yay.
Okay. Commissioner Gonzalez.
Aye.
Councilmember Yolanda Avila.
Aye.
Councilmember Sam Geek.
Aye.
Kari Kilroy.
Aye.
Doris Ralston.
Aye.
Dr. Vu.
Yay.
Chief Colas. Yay. And I vote in favor. So it's unanimous approval to set the date and have a public hearing. Thank you very much. Thanks, Kat. Thanks.
And I believe I heard Commissioner Bremer, she's the one that seconded it.
Okay. Moved and seconded. Is that what you're
You
talking
moved
about?
it, she seconded it?
Right. That sounds right. Okay. Youth suicide prevention update. It's been a while since we had one of those. Megan, Kelsey, and Fadi, please.
I did want to add, Dr.
Yes.
Turbish, you know, this is something that we've been heavily working on, and teen suicide prevention. And we do have our partners with the teen suicide prevention group, as well as the child fatality review team. Dr. Emily Russell, who is the Deputy Chief Medical Examiner for El Paso County Coroner's Office. Cassandra Walton, Executive Director for the Pikes Peak Suicide Prevention Partnership. Wendy Stevenson, Behavior Mental Health Consultant. Fountain Fort Carson School District 8, as well as our team here. But I did want to acknowledge that they are online as well and will contribute with this presentation, because this is not the health department's teen suicide prevention group, but it's rather a community-wide effort.
Thank you.
So Fadi, if you want to get started.
Sure. Good morning, everyone. Welcome to our new Board of Health members. Happy to kick us off. Vicki, if you go to the next slide, please. The purpose of what I'll be sharing in the next couple of minutes is just to give you an overview of suicide numbers in 2020. As you know, suicide numbers are an extremely sensitive topic, and we want to make sure that we understand the numbers and get them right. I never miss a chance to plug in a shout out to our corner team with Dr. Kelly, Dr. Russell, and their team. They provide us with granular data that really gives us an edge in terms of data clarity. In 2020, there were 178 deaths by suicide. That's compared to 180 in 2019. The age was slightly older. The mean was 42 and a half. The median was 39 years old. We did see a little bit of shift in the 40 to 59 and the 60 plus being closer to each other than previous years. Males continue to be the most prevalent group there. Every 4 in 5 suicides in El Paso County were males, an incredible number. Not much change in the other indicators. As you know, there are a lot of attention into suicide numbers during COVID, and we wanted to make sure to present this information so that folks are aware of the numbers. So 2020, we had 178, and 2019, we had 180. We can move on to the next slide, please. We also wanted to share with you 2 data sources together. The first data source is ideation and attempts through emergency department visits, as well as deaths by suicide through the coroner data. The emergency department visits, very little difference in terms of males and females, both for attempts and ideation. And we have a huge difference between males and females when it comes to deaths by suicide with the coroner data. We do know that males often use firearms at a higher percentage than females when it comes to deaths by suicide. We also wanted to update you with the Healthy Kids Colorado. The 2019 results came out about 6 months ago, and I don't believe we've had a chance to review them. So this particular slide set contains Healthy Kids Colorado survey suicide indicators. So our 2019 numbers trended with the 2017 numbers, not much change there. Among students that reported they've seriously considered attempting suicide, it's still around 1 in every 5. The students that made a plan about how to attempt suicide, it's still around that 1 in every 8. And the students that attempted suicide 1 or more times in the previous year, in 2019, it was close to 1 in every 10. I'd like to take this opportunity to just point out that we have data for El Paso County in 2013, 17, and 19. We are missing 2015, of course, because we did not have the required sample size. So we really try to emphasize the importance of participation in the Healthy Kids. It's a wonderful tool. It's a primary data, local data that gives us insight into a plethora of indicators, and this is just one example of them. If we can move on to the next slide, thank you. The students who attempted suicide 1 or more times during the last year, in 2019, we did see a difference between males and females. Females at 11%, males at 7%. So a higher prevalence, higher percentage, among females and males. The trend of the students that identify as gay, lesbian, or bisexual being higher than heterosexual, or the students that identified as unsure, continued in 2019 compared to 2017 and 2013. And that's all I had today. I'll be kicking it off to Dr. Russell.
Thank you, Friday. Dr.
Good morning. I'm Dr. Emily Russell. I'm the Deputy Chief Medical Examiner at the Coroner's Office. I've been involved in these child fatality review teams for about 10 years, starting in my training back in Dallas and filling in for Dr. Kelly when he was in my role at the office, and then stepping into his shoes when he became coroner. So this team, it's a partnership between the coroner's office and public health, and it's composed of a multidisciplinary team. It's a great group of individuals coming from law enforcement, the district attorney's office, various hospitals, different school districts, the county attorney, DHS, behavioral health experts. So we get a lot of great perspective on these child's lives and their struggles in this team. And we look at potentially preventable childhood death. And when we're looking at that, we have 2 goals. We de-identify the data and we enter it into a national database so we can look at trends and analyze the data for what's happening with these children. And the other part, the more positive part, is we make prevention recommendations. And these can be local recommendations to national recommendations that are looked at. So when you look at this chart, looking at 2018 to 2020 child deaths, CFIRT reviewed cases, you can see there's a pretty decent jump between 2019 and 2020. And that's partially due to an increase in our undetermined cases, which are at the bottom. And those are cases where typically we have a cause of death, but there's a lack of information in helping us determine the manner of death. So there was a slight increase in those at 5 cases, but then more so, there was an increase of 7 cases from 2019 to 2020 in the suicide, local suicides. That passes our previous high of 15 deaths, which occurred in 2016. So because of that high number, we changed our plan for this year. We started covering the suicides at the beginning of the year, and we started meeting twice a month instead of our regular once a month, so that we could look at what's going on and inform local prevention efforts earlier in the year. And I think now I can turn it over to Cassandra Walton.
Thank you, Dr. Russell.
Hi there, my name is Cassandra Walton. I serve as the Executive Director for Pikes Peak Suicide Prevention Partnership, a nonprofit here in town that provides free support services in the name of suicide prevention. I'm presenting today because I am immersed across the suicide prevention efforts in El Paso County, so I'm able to kind of give you an overview of the observations that we had throughout 2020. That's because I serve as the Vice Chair for the Suicide Prevention Collaborative of El Paso County. I actively serve on our firearm safety work group, I chair our postvention work group, and I participate in the youth, the YSP group through the public health department. So what we saw in 2020 is that we started the year with just a huge amount of momentum. We had a call to action at the beginning of the year where there were over 500 attendees, and our community was very ready to address the topic of suicide. Fast forward to a couple of months in March, one of our efforts included doing a postvention panel for a high school that had been impacted by suicide, where for the first time we had really interesting partnership with the school. We were able to do a student panel where every student was invited to participate. And then on a day we offered 180 people that included their parents and their staff and trained them all in youth mental health first aid. A few days after that, the pandemic hit. And so we suddenly, the word pivot emerged into all of our conversations, and we had to start talking about how do we do this work virtually? How do we continue to do this work safely, knowing that with the pandemic, our needs might change, and we would still need to be able to reach our community, especially our teens. So with that, you saw our community come together and create the Beyond the Curve campaign, which was done through surveying a number of El Paso County teens, and then a group of El Paso County teens created all the material that is presented on that website, which was primarily made to provide resources to our youth who are trying to deal with living through the pandemic. You saw organizations like Education for a Lifetime, NAMI, Pikes Peak Suicide Prevention begin offering our services virtually, and you saw the schools really trying to do, virtual check-ins and reach out in all these different ways to address mental health for people who were stuck at home. For us, what we saw was we immediately saw a 70% increase in calls for our services at the first stay-at-home order. And then we saw our one-to-one peer support become our most popular service that was accessed during the pandemic. And what that was is it provides a peer support volunteer that does proactive check-ins. So they call or meet their program participant on a scheduled cadence throughout the week, just to provide that human connection, because we know that connectedness is a strong preventative factor for suicide. As the pandemic continued on, we really realized that our youth were feeling very isolated. And so Pikes Peak Suicide Prevention, Inside Out, a number of different community partners really worked to get some in-person services back in place as soon as we were allowed and could safely do so, just to create some ability for our teens to have real in-person connection. And so for us, the other thing that we had to do was we had been in the development process of a teen mentor program to help increase the number of trusted adults in our community. We expedited that process and actually began running a pilot program just to create that resource as soon as possible, because we really saw the need for teens to have a trusted adult outside of the family system increase during the time of the pandemic. In addition to that, we saw our calls from parents increase regarding their teens experiencing suicidal ideation or being hospitalized for attempts or increased suicidal ideation. And the support that those families were really needing was, how do we implement a safety plan in our home? Many times, they were able to partner with the school in the past for this type of thing, but they were really having to learn how to increase that supervision, how to reduce access to lethal means, how to allow their teen to stay connected while still maintaining supervision and safety. As schools started to begin to have hybrid plans where they were having virtual and in-person meetings, we were having to support parents in how do we re-enter our student into the school system after they've been hospitalized, and helping to teach them to learn to communicate with the schools effectively, and then helping them work through how to access all of the different service referrals that they receive upon the time of a discharge from an inpatient stay. Most recently, we've seen an increase in postvention referrals. So these are the referrals for services for families and youth who have been directly impacted by a recent suicide or a suicide attempt. And those services include bereavement meetings where we meet with the family and we talk about what they can expect, common factors of suicide grief. We help them coordinate the different services that they might need. And we connect them with usually a peer support and then group support regarding, being able to connect them with other suicide loss survivors. And so I've just tried to give you an overview and a summary of the suicide prevention needs that we've seen grow across the time of the past year. And what I want to emphasize is that our team needs often reflect our community needs because the things that they are needing are just common among what is required and needed for all of our community for suicide prevention. And so what we've really seen and are focusing on right now is we need more people in our community to understand how to identify who might be at risk and what to do. And so because of that, many of us have been trying to increase our focus on providing gatekeeper training, and we've seen a great response to that in our community. Pikes Peak Library District trained their entire staff, which is over 100 people. Diversus Health, we train their staff, and they're offering a community training. District 49 had some of their staff members trained to be QPR, which is Question, Persuade, Refer, a gatekeeper training. We've been training health provider groups, their staff. We've been training churches and parent groups. There continues to be a need to help our community understand how to identify and what to do, just because right now we never know what the environment is going to be or when the environment is going to change and what resources are going to be available to get eyes on the individuals who might be at risk for suicide. As mentioned earlier, the issue of firearms is really still prevalent in our community, and really needing to emphasize the idea of safe storage of firearms, because we know that that's the most access lethal means. So we are seeing a need in our community to have that conversation and talk about that. And so there are active efforts for that. Pikes Peak Suicide Prevention has been contracted by the Office of Suicide Prevention from the state of Colorado to do some advocacy work and reaching out to our firearm community. And, the El Paso County Collaborative has created, some public service announcements and some different materials to try and encourage that as well. we're needing to see, across the board, but especially with our youth and families, just an increase in postvention standards. So that means policies and procedures. We've created a training program to encourage our local media partners to pledge to have safe and responsible reporting. And we're working very hard to get suicide survivor advocacy teams in place that would be deployed upon a suicide in our community. And then, of course, the YSP group through, El Paso County Health, we've really identified, and this is across the board, again, across our community, not just with our youth, but a need to streamline that referral process. And to provide a tool to help our families navigate all of the different resources. I can tell you that we try, we've done a lot of tests to figure out, okay, what happens when a family is in need? What happens? And so, yesterday we did some calls around just to see, and we saw that the wait list for individuals who are on TRICARE, which is a large part of our community, individuals who are on Blue Cross Blue Shield, they're being placed on really long wait lists. And then being told, go to psychology.com to try and find a private provider who might be able to serve you while you're waiting to get access to these other providers. Oftentimes the providers who are connected to other programs like IOP programs, which is an intense outpatient program, or different programs that would help the overall quality of life for the teen. And suddenly those services have to become segmented because of the wait list and their inability to access a provider who's linked to those programs. So just needing an avenue to navigate those community supports. And that is something that our YSP group is actively looking at. We had a group of students from Colorado College create an outline for a tool, and we're looking at that. So important to note that through all of the challenges that I've just listed off, there are active efforts addressing each of those things. But we have a lot of work ahead of us, and luckily we have a community that I think is poised and ready to address these issues. That's what I have for you today.
Thank you.
All right, good morning. My name is Wendy Stevenson. I'm a behavior mental health consultant in Fountain Park Carson School District 8. I also co-chair the school subgroup committee for the Youth Suicide Prevention Work Group. Some things about our Youth Suicide Prevention School Subgroup Committee is that we represent 10 different school districts across the county, and our mission is to join school and community suicide prevention efforts by educating our youth and caregivers through awareness, resilience, and recovery. So a few things I'm going to share with you today are going to be some school challenges that we've seen this school year, successes, and then some plans moving forward into next year. So the responses that I will share with you are collective responses from several different districts across the county, and I think that many of our experiences have been fairly similar, whether it is the challenge or the success, and also moving into next year. So I definitely believe that everyone's challenges have kind of aligned and have seen similar successes. To start with challenges that we wanted to share with you, we believe that the biggest impact that we've seen this school year is just that inability to have strong relationships and just those connections with youth in a virtual context. So we know that student-to-student interactions, adult and adult interactions have really been hindered, whether that is in a hybrid learning or the remote learning when students and classrooms are in quarantine. We know that relationships have significantly been impacted this year. With that, we have seen a great degree of anxiety and depression among students and staff. So I think we could tie some of that to this inability to connect, since we are all innately want to connect with one another, and just the situation of this school year has really limited that ability to connect. So we've certainly seen an increase in that anxiety and depression. We've seen that youth have reported an increase in substance use throughout the school year, which is interesting because drug referrals through behaviors have actually been lower. We've seen that supporting staff have been really challenging this year. We think that there's been burnout for a variety of reasons, to include stress, just their own emotional needs, worry that they have about their students, the student safety, their family safety, this incorporating of so much technology and new platforms. We also know that staff have really been challenged with this work and family life balance when expected to work remotely or when their classroom is quarantined. Some other challenges that we've seen this school year include just the family, school, and student disruption that I'm sure many of you have probably experienced in your own homes and in your own lives, but just that inability to have routines, rituals, those norms that you get on those everyday interactions and expectations from coming to school when you are in a remote, virtual or hybrid setting. That uncertainty of if your class would be quarantined or if you as a student would be quarantined, the stress that families would experience when a class does get quarantined and now you're looking for childcare for those elementary age students. We know that families are experiencing grief and loss at higher degrees. We know students have less direct instructional days, low availability of parents oftentimes. We also know that just by learning online that there are a lot of different disruptions in the environment to include pets, different behaviors that students are exhibiting when you're learning online and through a webcam. We know that attendance has really been a very big challenge this year, I think for a variety of reasons. I do think that a lot of our students have greater responsibilities, making that school priority very low. So although schools are back, we've seen a really impacted degree of our students that are attending. So we know attendance was low in a virtual setting, and then also returning in person, that attendance has not really increased, but we do kind of tie some of that to just that increase in student responsibilities. So we know with poor attendance, it's going to impact grades and also that on-time graduation rate and the expected graduation rate for this year. Another challenge that we have seen is just having small group cohorts mean that less students are being able to be met by school mental health professionals. So we've seen in the past that school mental health professionals are able to have group meetings. So if that's a social skills group or anxiety, depression, family concerns, whatever group that is, with the inability to cross cohorts, that the number of students being seen is actually lower, which is really unfortunate knowing that the need of students is higher. So moving on, some of the successes that we have seen this year is that mental and physical health have really been prioritized over academics. I do believe that this normalizes the mental health need in a way that we've probably been wanting for so long, but with many to all people really focusing on their mental well-being and their physical well-being during this time of COVID. I think it has normalized mental health some and really decreased that stigma. So that's a win. And we've really tried hard to connect families to needed resources and community supports. We've seen a lot of families that haven't needed resources before, and really trying to be proactive and getting all that information across to all families, really trying to make sure that we're not selective or really only providing resources to the families that we know of. So really trying to communicate across all levels within the community to ensure that there are resources available and what those resources look like. Another win that we've seen is that there are full-time school nurses at each building due to COVID dollars. So this has led to less student and staff illness due to health protocols that are involved. And we know that virtual trainings to support staff and parents have been better attended. We do think that since it's an opportunity to attend virtually, or if that training was recorded, that you could watch it at your own time. So we have seen that parent trainings that really have been poorly attended previously have seen an increase in those. in that attendance level. Some other things that we have seen are that teachers are implementing kind of SEL programs or prevention programs and curriculums to students. So instead of that being offered by maybe the mental health staff in the building, that teachers are really doing it. So whether it's skills about coping skills or talking about stress, anxiety, and working that into their curriculum has really been noticed and seen across several districts. We've seen that students have seemed to enjoy, at least our secondary students have seemed to enjoy being back in-person learning. So we see that behavior referrals are lower. So we're uncertain if this is kind of a honeymoon period or if that will just continue with that absence of in-person school and then returning. We have seen that our behaviors have decreased significantly. Another positive thing to know is that students are learning to be resilient and flexible. So certainly skills that we want them to have throughout a lifespan, and knowing that they can bounce back. They're going to have that great ability to be resilient through this experience, and then they're going to be able to carry that on into adulthood. Small group instruction and class sizes when we've returned to in-person learning has been great for being able to build those relationships that were really absent in a virtual setting. We've seen that parent meetings, the attendance of parent meetings have increased. We do think that's because there is just that virtual option. Takes less time, whether you have to leave work or just those duties that you have within your home, knowing that you can just log in remotely and join a meeting. And then when you're off, you're at home. So we see that attendance has increased. We know that creativity and resourcefulness among students and staff is at an all-time high. The integration of technology, of course, and then talking with our law enforcement officials, they have said that calls for service have decreased, specifically just across the community, but also crimes committed by juveniles have also decreased. I think the hesitation there was there's also less reporting, so less calls for service for domestic violence, child abuse, without youth being in the building, without having those physical eyes on. We know that the calls for child abuse reports and everything else has been down. So just moving on, some things for next year that we're looking forward to is really just to continue focusing on that student and staff well-being with a focus in mental health and trauma. I do think that mental health teams across the county have had meetings to really try to plan for next year to support students, to support staff, and really just try to have preventative measures in place to really help bring back students in an effective manner for next school year. We also know that increased school nurse positions will likely remain for most districts, so we're really pleased with that, with having the options to have a school nurse available with health protocols, knowing that they work this year, hoping that we can move some of those protocols into next year as well. And really just trying to be proactive about programs and resources and support that we can offer to our students, to our staff, to our parents, and our community.
All right, thanks so much, Wendy. Hi, everyone. I'm Megan Haynes, Teen Suicide Prevention Planner for El Paso County Public Health. I have the privilege of sharing with you the efforts our community is undertaking to address youth suicide in our county. As you may know, El Paso County Public Health has been convening and facilitating the Youth Suicide Prevention Work Group since July of 2016. The work group takes collective action in support of youth mental health and suicide prevention, and it has grown to involve more than 90 community partners from various sectors across the county. The work group has a steering committee that oversees and supports implementation of community-driven strategies to prevent youth suicide, and much like the work group, reflects the cross-sector collaboration that's necessary to address this complex issue. Some partners involved in the work group and steering committee include youth-serving organizations, school districts, behavioral health organizations, hospital systems, nonprofits addressing mental health and suicide prevention, and faith-based organizations, among others. Next slide, please. In 2020, we knew that it was crucial that our collaborative work continue despite the disruptions, added stressors, and grief that many experienced due to COVID-19. As Dr. Russell mentioned earlier, we were incredibly fortunate to have our work group, steering committee, and child fatality review team quickly pivot to virtual meetings, pausing for only 2 months early in the pandemic. Our steering committee even agreed to more frequent meetings to keep efforts on track through the youth suicide prevention work group. As we moved into 2021, we planned activities that would help us better understand the issues surrounding youth suicide in our community in 2020 and move us toward action. We prioritized suicide fatality reviews and engaged youth to identify prevention opportunities sooner and work with the work group to operationalize them. We conducted a needs assessment and gap analysis in the work group, prioritized our gaps and needs, and assessed our current strengths to address them. This month, we began developing community goals for our 2021 action plan, and as we move through the rest of the year, we will be doing monthly report outs on progress, problem solving, and tracking local data to assess impact. While we're still in the process of action planning, I did want to highlight a few goals that our action plan will include, including adoption of a universal release of information form to enhance communication and coordination of care for youth at risk for suicide, and expansion of local parent-informed resources on youth suicide and mental health-related issues. And now I'm going to turn it over to Kelsey Leva.
Thanks, Megan. I'm Kelsey Leva. I'm the Youth Health and Development Planner for El Paso County Public Health. Vicki, you can go to the next slide, please. And I'm going to wrap up our presentation today just by sharing with all of you some of the ways that we can all be involved in suicide prevention in our community. One of the first things we can do is normalize help seeking and hope when we have conversations in our circles, and we can share stories of resilience with our professional and our personal friends and connections, and we can also do that when we have interviews with the media. We can also change our language so that we're more approachable to those who are struggling with suicide, and so that we're more respectful of those who've died by suicide and their family members who've lost loved ones. So what we want to do when we change our language is use words like died by suicide or attempted suicide, and avoid using language like committed suicide, completed suicide, or referring to a suicide as successful, unsuccessful, or a failed attempt. But definitely don't let these pointers stop you from talking about suicide. In fact, that's what our next recommendation is all about. We all need to be prepared to have a conversation about suicide with someone in need. And as Cass mentioned earlier, one of the trainings we're really asking for everyone to take is called Question, Persuade, Refer. It's a 2-hour gatekeeper training, and we'd specifically really love for our Board of Health members to attend one, and we'll be sending some information to you after this meeting and encourage you to participate in that. And next slide, please. We know that many of you are having conversations in the community about this issue, and it's something that it deeply impacts many of us. So we wanted to take a moment to share some really helpful resources with you. The first 3 resources on this page are locally driven and locally developed resources. And so the first one is Protecting Youth from Suicide. It's a flyer that was developed by parents for parents in our community. It's available in English and Spanish. And then there are 2 campaigns there, Beyond the Surface, that Cass mentioned previously, and Below the Surface. All 3 of these were developed with local input and really are well positioned to address the issues that families are facing in the moment right now. I also want to make sure y'all are aware of Colorado Crisis Services and the resource that is in our community. It's a 24/7 resource that's available, licensed counselors who can support people who are going through any level of crisis. And that's available through text, talk, and a walk-in location. And then last but not least, I want to just ask for all of your help connecting anyone who's passionate and involved in this issue to the Youth Suicide Prevention Work Group. We really appreciate any and all input on this topic, and we need your help in pulling individuals who are passionate about this into the work. So please do help us make those connections, and we know we'll have a better a better reach in our community because we're doing work in that way. So, and that concludes our presentation. All of the speakers are available to answer questions, and we're happy to do that now.
Thank you, Kelsey. Great presentation. I would say count us in. Count in the Board of Health members as passionate and involved, and I really look forward to seeing the persuade, refer, gatekeeper training. That would be great if you could share that with our Board of Health members. Thank you very much. Any other questions or comments from Board of Health? Nope. Okay. Susan, yes.
I would just like to thank, all of the members of the Child Fatality Review Team, Dr. Emily Russell and the Coroner's Office, as well as the numerous different suicide prevention groups. And as the presenters presented, there were numerous calls to action. So there are numerous ways to be supportive and get connected, with people in the community to really, fuel some more of these efforts. Really what it's going to take a community, and it's not just, one or two or three different organizations. So I would just emphasize the many different calls to action. And then also in the data that Fadi had presented, that it's extremely concerning that with teen suicides, that we are experiencing heartbreaking situations. And we know that Colorado Springs was put on the map, I think it was back in 2014, with Palo Alto, California, and Fairfax, Virginia. And that's not a designation that we want to have is experiencing so many teen suicides. It's heartbreaking, and I would just emphasize the call to action and the tremendous amount of work that is so heavy that all of the members of the different efforts are engaged in. And I just wanted to say a heartfelt thank you, because I know that it's very, very difficult work and very meaningful at the same time. So thank you for that. We will continue to keep you updated on efforts, and thought that this was a good opportunity to do that. So thank you for that. Moving on to my director's report, we are going to end at 10:30 a.m. this morning for our Board of Health meeting. I will need to lead the policy group. Dr. Vu, you're welcome to come to my office to attend, because I know Dr. Tierbush and you both are part of that. We are going to get started with an update with the public health order from our county attorney, Diana May, and then we'll go into a high-level view of the data and our vaccination status, and wanted to provide an update on outbreaks within the community. Natalia Gayu, who is our epidemiologist. And then we also have some updates on our equity and our points of dispensing. And we are doing a phenomenal, job with using the El Paso County South building. We thought 30,000 square feet was a lot, but I tell you, all of that is being used, and we are serving thousands and thousands of people in that location, and we just are getting started. And then we also have an update on our vaccine campaign. So let's see how quickly we can move through this. But I will ask Michelle if we need to keep to 10:30. And if we don't get to that 10:30 mark, we'll send information out through email if that's okay. And then we'll highlight some other stuff to be respectful of time. So with that, Diana May, if you could give us an overview of the current public health order and kind of what we see in the future.
Good morning, everybody. I'm going to kind of quickly go through these slides. They are available. If anyone has any additional questions, I'm happy to meet with anybody. But I'm going to go ahead and go to the next, if we can move to the next slide, please. Basically, the COVID dial was not renewed, and with that, the court or the state placed some basic kind of overlay requirements and made it so local control could proceed forward. And at this point, Susan Whelan in local public health has decided not to place any additional restrictions. So what we have as far as restrictions are those state requirements that are kind of overlay right now, the public health previous restrictions. And so I'm going to go ahead and go through those just briefly. So with the dial being gone, if we could go to the next slide, please. The relevant issue for El Paso County is face masks are still continuing. If we're dealing with a public indoor space where there's 10 or more unvaccinated or unknown individuals present, and that's because of our incidence rate at the present time. Next slide, please. I'm going to go ahead and just briefly say face coverings are required in a variety of settings under this new public health order, including schools and the same type of facilities that the previous mask order covered. So the mask order is set to expire on May 3rd. However, the governor has included the mask provisions in his public health order that went into effect on April 15th. So at least through May 15th, face coverings will be required in the various settings that I have on this slide. Next slide, please. The exceptions that we were used to still apply, 10 or younger, individuals who medically cannot tolerate it, and then the individuals listed in the governor's mask executive order that are on the next slide, please. So these are the ones that you all are used to, such as Dr. Turbush, when you're speaking on behalf of the board in this type of setting, you're obviously able to remove your mask. So these are the same requirements that were allowed for in the public health order for exceptions to the mask order. Next slide, please. The significant changes are not in schools. Schools are still in the same requirements of school guidance that were implemented early last year in the school year. So nothing has changed in schools. It's still the same. We do a very good job communicating. Susan has a great schools team that communicates with the schools. Next slide. The two areas that I want to just briefly spend a little bit of more time on is outdoor events and then indoor events. So under this new public health order, what is the requirements now in El Paso County for outdoor events? Deal with an outdoor seated ticketed event, because as you can see, an unseated outdoor event such as a parade, maybe a festival, do not have any restrictions. So the only area that is restricted is an outdoor seated ticketed event over 30,000 square feet. And in that scenario, that the event coordinator would be required to coordinate with El Paso County Public Health, and then we would then coordinate with the state public health on capacity limits and disease mitigation. Public health has made this very clear, state public health, that this provision is meant to incorporate events such as a concert at Red Rocks, a concert maybe at the Vibe Stadium, the Rockies game, Denver Broncos football games, that they're very much intending that this, when they use the word ticketed, it's for a sales event where someone receives a seat where they have an assigned seating in a large scale venue. We may have a few of those different venues here in Colorado Springs, but that's what they're meant to cover. It does allow for the 5-star certified businesses and prior variances to remain in effect. Next slide, please. Indoor events is where it's a little more tiered, and there's 3 separate tiers. Basically, there's the tier dealing with under 100 people. So again, reminder, face masks are still required for indoors. But if you have an indoor event less than 100 people, there are no restrictions on gatherings of 6-foot distancing or keeping household members together kind of in their own pod. So less than 100 people, there's no restrictions other than masks. Between 100 and 500, the requirement other than masks is that individuals must have a 6-foot distancing between non-vaccinated people and unknown vaccinated people. And so the event planner or the business would need to then determine whether they wanted to evaluate whether a person is vaccinated or not. If they choose not to ask that question, they would assume that they're non-vaccinated or unknown, and there would need to be that 6-foot distancing between those groups. For indoor events over 500, of course, masks are still required, but prior to any of those events occurring, they would need to request a variance through the local public health and the state public health. 5-star certified businesses and prior variances are still in effect. Next slide, please. There is an exception for that indoor gathering, over 500 people that we just went through. It does not apply to places of worship and associated ceremonies, retail businesses, we kind of call those big box stores, restaurants that have sit-down dining and do not have an unseated area where there's 100 or more people that could gather, such as a dance floor. So basically, you know, for churches, a big box store or restaurants, there's not that requirement anymore of 6-foot distancing between parties. Masks are still required unless an exception applies. Also, they had accepted from this requirement proms and graduations, but if they wish to exceed that 500, they need to get approval from local public health. Next slide, please. Just one reminder that they did include, while there is local control allowed, there is a provision that says if the hospital capacity, system capacity threatens to exceed 85%, that the state may require the counties to impose some additional restrictions to mitigate the disease transmission. So there, while El Paso County does not have any additional restrictions in effect, we always need to be mindful that if our capacity starts getting to that 85%, the state could intervene again. Next slide, please. So quickly, I went through that. If there's any questions offline, I'm happy to answer any of them or answer any questions now.
Thank you, Diana. That was great.
Diana, and the only thing I wanted to clarify is that through May 16th, that the current public health order will require face masks in government buildings and otherwise, because I know that there's another state mask order that expires May 3rd, but the public health order extends through May 16th. Could you just clarify that?
Absolutely. So basically, the governor incorporated a mask order in this public health order. So while people keep thinking the May 4th date, the mask order for the state may end, you are 100% right, Susan. Face masks are still going to be required under the public health order through the effectiveness of Public Health Order 38, which is May 15th. So yes, you still have to wear masks indoors. And some counties may have some additional allowances, but we're not one of them because our incidence rates are too high.
And I think that's important because when the communication comes about May 3rd, knowing that all of the municipalities in El Paso County and government buildings and schools, that it still extends through May 16th. So not that it's just, going away May 3rd. So thank you, Diana. I appreciate it.
Sure, absolutely.
We'll move on to Fadi, you're on, and then I know you need to be on the policy group here soon, and so if you could go maybe through the highlights, and then we'll go to Natalia.
Sure, I'll give a very quick verbal weather report. Incidence and positivity are elevated. They're both levels we haven't seen since mid-January. Our hospitalizations are increasing, and our hospital partners last night decided to move the hospital capacity from green to yellow. That is a decision that we go through every day, where the hospitals feed us daily census. Just to give you context, the official description of moving from green to yellow means that it is good, the capacity that is, but elevated hospitalizations and census are being experienced by our hospital partners. On vaccinations, we've vaccinated 41% of our eligible population. We're fortunate enough to have data from our federal partners that bumps the percentage to about 48%. We anticipate hitting the halfway mark either by the end of this week or early next week of vaccinating our eligible population. We do want to mention that we're particularly concerned and focused on the lack of vaccinations among younger decades, so especially the 20 to 29. To give you a little bit of a context in there, about 90,000 people remain unvaccinated in that 20 to 29 group. And for us to reach, Dr. Turbush, the herd immunity that you mentioned earlier, we we need that younger age group in order for us to move toward that 75% goal.
And we have aligned with the statewide goal of vaccinating 75% of El Paso County's eligible population with 1 dose or more by July 4th. And Fadi, do you want to confirm that if we keep up the momentum as we currently are, then we are going to achieve that goal by July 4th? And that's, it is doable, but we need to keep up the momentum.
Yep, based on our historical efforts, past 3 weeks, past 4 weeks, we will hit that mark. But again, we will need that 20-29, 30-39 in order to meet that goal.
Thank you. And I wanted to acknowledge the Vaccine Consortium, and I know Dr. Vu and Dr. Chirbush are part of that. But again, you know, public health does not work in a silo. We work through collaborations and numerous different for-profit and nonprofit partnerships. We are shifting and expanding vaccination opportunities, and I would say that you know, we're pivoting again because we know that supply has increased. When we began, supply wasn't plentiful, but supply now is plentiful, and so the demand is not as tremendous as it used to be. Therefore, we're getting more strategic around how we are providing vaccinations. And today, as an example, we are working with Cheyenne Mountain School District to provide one of our mobile vaccination vans with the mindset to make it even easier to catch people where they are and get them vaccinated. We are working with numerous different business entities, and we'll have a vaccination van downtown. We are working with Pikes Peak United Way when they are doing their food distribution sites. So making it even easier, building upon the multitude of ways that people can access vaccinations. So I think that that's where we need to pivot and working with trusted partners. And the wonderful thing about this too is that public health is providing the resources, vaccinations, and supplies, but we're relying on our trusted partners to do the outreach and to gain that interest. And we're there to educate and provide information about vaccinations even before these mobile vaccinations go out. But really, that's a shared partnership where we are both working together. And I forgot to mention too, we are working with the faith-based community. So there's numerous different cross sectors that we're working with. So I won't go through that part of the presentation this morning. It is in the packet, but we'll send information on the vaccine campaign. But what I would like to do is close out where I think is new information, is giving Natalia an opportunity to run through where we are with outbreaks in El Paso County, and then we'll close out.
I can stay here if you need to.
Okay.
Natalia?
Good morning, everyone. This is Natalia Gallo. I lead the outbreak team. And we can go actually to the second slide of outbreaks. I just wanted to briefly go through the trends that we're seeing recently here in El Paso County. If you could go to the next slide, please. Thank you. So since the beginning of the year, we've had 102 confirmed outbreaks, and that's not including schools and long-term care facilities. So we're seeing those primarily in retail and office settings, as well as restaurants. To compare, last year between March and December, we did have 237 confirmed outbreaks. And I have this graph here to show how many outbreaks have been reported per month since the beginning of the pandemic. So as we can see here, this epi curve looks quite similar to the incidence epi curve. It's almost an exact mirror. One thing of note is that for the 2021 outbreaks so far, the outbreaks have been slightly smaller, so they have an average of 5.6 cases per outbreak. However, we still see higher case counts in retail, office settings, restaurants, and of course, congregate living situations. Next slide, please. Thank you. The main thing that I wanted to bring up with these outbreaks is what we're noticing is that cases and contacts are returning to work too early. There's been situations where individuals are following the shortened quarantine options of either 7-day with a negative test or a 10-day, and unfortunately they become symptomatic on, let's say, day 11, which unfortunately exposes their coworkers. We've also seen individuals working while ill for up to a whole week or maybe even 2 weeks before getting tested.
and unfortunately they end up positive and have exposed their coworkers for an entire week or their entire infectious period. And we're also noticing no or poor mask usage. There's a question about vaccine and whether or not that has impacted outbreaks at this time, and not yet. Unfortunately, a lot of these outbreaks are in the populations that were not eligible for vaccine into the last phase. So we're still kind of waiting to see how vaccine uptick will help with outbreak identification. However, we have had less hospitalizations. I know that was really fast in the interest of time, but those are the basic trends that we're noticing right now.
No, that was great, Natalia. Thank you very much.
No problem.
Appreciate it. Good update. All right. Well, let me open again to any other Board of Health member comments or questions about the data that's been presented about COVID. Well, thank you for the very complete work in these presentations. Do we have any public comments?
No.
No, none online or in person?
None.
Okay. Last chance. All right, I'd entertain a motion to adjourn.
Motion.
And a second?
Second.
Okay, thank you very much, and we'll meet again in a month.